You know that deep, nagging pain in the buttock that just refuses to go away? It's a seriously frustrating problem, one that can stump even the best doctors. Well, today we're putting on our detective hats because we're going to solve the mystery of deep gluteal pain. So, what makes this such a tough case to crack? Well, the biggest problem is that it's not just one thing. It's a whole collection of issues that have really similar overlapping symptoms. It's a real diagnostic puzzle. So, how do we solve it? Well, like any good detective, we start by heading to the scene of the crime.
And that scene, it's a very complex, kind of crowded neighborhood deep inside your hip, a place we call the deep gluteal space.
Now, don't think of this as some empty cavern. It's more like a busy intersection at rush hour. You've got bone, ligaments, and major muscles boxing it in. And all that density, all those structures packed so tightly together, well, it makes it a prime spot for trouble. And the main person of interest trying to navigate this busy intersection is the sciatic nerve. This isn't just any nerve, it's the largest one in your entire body. And on its journey, it has to squeeze past all sorts of potential pinch points, muscles, fibrous bands, you name it. Any one of them can cause some serious irritation. And one of the most notorious characters in this neighborhood is the piriformis muscle. It's a major landmark. In fact, for about 90% of us, the sciatic nerve has to duck right underneath it. As you can imagine, that particular intersection is a very, very common site for nerve compression. All right, we've surveyed the scene. Now it's time to bring in the usual suspects, the conditions that are most often behind all this pain. And here is where the plot really thickens. All our suspects can kind of look alike. They all cause that deep buttock pain, and they can all send sciatica-like pain shooting down the leg. It's like they're all wearing the same disguise. So how in the world do you tell them apart? Well, you have to look for the subtle differences in their behavior. Okay, this is where we start to crack the code. Take a look at the pain while sitting column. See how both deep gluteal syndrome and hamstring syndrome cause pain after you've been sitting for a bit? But ischiofemoral impingement? Nope, no pain while sitting. That is a massive clue. On the flip side, pain when you're walking, especially with big, long strides, points us toward the other two suspects. These are the kinds of critical first clues we get just by listening to a patient's story. So we've taken the initial report. Now the real hands-on investigation begins. This is where clinicians use specific physical tests to kind of poke the suspects and see which one reacts. First step is the long stride test. And it's exactly what it sounds like. The patient just walks with these big, exaggerated steps. But here's the genius of it. The key isn't just if it hurts. The real clue is when it hurts. And check this out. This one simple test can help us zero in on a suspect. If the pain hits the instant your front heel touches the ground, that screams hamstring syndrome. But if the pain shows up when your back leg is stretching all the way out behind you, well, now we're looking at ischiofemoral impingement. Same test, two totally different culprits. It's pretty cool, right? Okay, on to our next test. Remember that piriformis muscle? We're about to put it in the hot seat. With the active piriformis test, you lie on your side and try to push your leg up and outward against a little resistance. If doing that brings on that same deep gluteal pain, it's a pretty strong sign that the piriformis is causing trouble for its neighbor, the sciatic nerve. So, you're probably wondering, how reliable are these clues really? Well, when you combine this active test with a passive stretch, the accuracy is frankly amazing, a 91% sensitivity. Basically, that means if you do have the problem, there's a 91% chance this test is going to find it. That's a really powerful piece of evidence for our investigation. So these physical exams give us really strong leads, but to truly solve the case, to be absolutely certain, we often need to bring in the forensics team. We need a way to see exactly what's going on in there. And this is where the MRI comes in. It's honestly like getting crystal clear surveillance footage from inside the body. It allows the investigators, the doctors, to see all the soft tissues, the muscles, the nerves, and look for telltale signs of trouble. And this tool is incredibly powerful. There's a specialized version called MRI neurography that's basically a high-powered zoom lens just for nerves. And get this, it has a 93% sensitivity for spotting deep gluteal syndrome. It can literally make an angry, inflamed nerve light up on the screen, giving you clear photographic evidence of the crime. And for the final confirmation, the confession, if you will, we have diagnostic injections.
A doctor can use imaging to guide a needle to a very specific suspect, like right into the piriformis muscle, and inject a little bit of local anesthetic. If the pain just vanishes, even for a little while, case closed, we found our culprit.
So, once the mystery is solved and we know exactly what's causing the pain, we can finally move on to a resolution.
And here's the great news. The path to getting better almost always starts with conservative stuff. Non-surgical treatment is the first line of defense. We're talking physical therapy to stretch tight muscles and strengthen your core, and sometimes injections to help calm things down. Surgery is really held in reserve for those stubborn cases that just don't respond to anything else. But even for those who do end up needing surgery, the outcomes are incredibly encouraging. Whether it's releasing the piriformis muscle or decompressing the sciatic nerve, studies show really high rates of patient satisfaction and huge drops in pain. So there's absolutely real hope for closing the case for good.
So yeah, deep gluteal pain is a complex mystery, for sure. But it's a solvable one. It just takes a methodical investigation, understanding the anatomy, knowing the suspects, and using the right clues. And the biggest takeaway is this. A vague complaint like buttock pain has specific causes. And now that you know the suspects and the clues, maybe solving your own mystery starts with asking the right questions.